Okay, hello everybody. Thank you for those who jumped on early. We've had quite a bit of interest in this session today, so it is a little bit shorter than our normal webinars, so I am going to run through this pretty quickly. Before we get started, just a couple of housekeeping things here. This session is recorded, so if you cannot stay for the whole time or you have other people in your practice who would be interested in watching, this will be uploaded and available later this afternoon and will be listed on our education portal. Today, I will not be covering any of the basics of how to get into reports, etc. We do have a multitude of pre-recorded webinars that we've covered over the past year and a bit more that generally contains that information, or of course you have your resources in your PHN staff members. I currently have a heavily snoring puppy in the background. I do apologize. While she's sleeping, she's not pestering me for a WALK, so I'm going to leave her and I apologize in advance. We will be taking questions, encouraging questions to come through throughout this session. However, just with the time imperative, I want to make sure that we cover the report in enough detail. We will then answer as many of the questions as we can through at the end of the session, and then we will endeavour to get an FAQ written up out of whatever questions we have come through to be distributed via your PHN. With regards to that, if you do have any other follow-up questions after this session, please do contact your PHN representative and they will either be able to answer or get back to you. Again, really sorry about the snoring in the background. Fantastic. Now, Jason, I'm just going to do a quick audio check. Can you hear me? I probably should have done that before I started talking. Jason, don't leave me hanging. Please tell me you can hear me. Okay. Jason, that's you?
Yep. All
great.
Good.
Okay, so you can hear me? Excellent. Okay.
All good. Sorry about that. Yep.
Perfect. Thank you very much. Great. So welcome everybody to this session. Obviously, this has been a pretty energetic process across the board. We did end up releasing this report a little bit earlier than we expected, just as a response to obviously the Health Direct and booking website went ahead a little bit earlier than everyone else expected. So we did get this out late Thursday / early Friday to everybody. I will put a big disclaimer on this report. It has been and remains to be a bit of a moving target. So please do bear with us. Obviously, the patient cohort information has been changing pretty rapidly, especially in the most recent period. So we've sort of been keeping up to date. Jason, if you can mute yourself, sorry. Keeping ourselves up to date with the specific around the patient cohorts, based on whatever the most recent information is. So hopefully we've hit a bit of a nice spot where everything is static, but who knows. So today, I just want to cover off very quickly the new report, looking at a few different aspects. So firstly, the phase tracking component, then the rollout information. So we'll cover that one. That'll make a little bit more sense. Patient phase details or phase details / criteria, and then also mapping. So I'll show you how to access the mapping, which will give you a bit more detail around exactly how we're picking these patients up in your clinical software, and a few of the nuances associated with that. Look, as I mentioned, I am not going to cover off how to actually access this report in your system. Plenty of information on the education portal, and also you can have a chat to your PHN rep to find out how to do that. More importantly, I think, is actually access this in the report. Now, everyone should have access to this already, as I said, as of Friday last week. So if you do not, again, touch base with the PHN, and they should be able to help you get access to it. So this is the COVID vaccine report. Now, I will say one thing is we've been populating this data around flu vaccinations just because there's not enough data to demo with at this point in time. But just if you just ignore that part, it should make sense. So without further ado, talking about this report. So we have in this the three major components around the phase tracking, rollout information, and phase details. Our phase tracking is the first tab that we're landing on. So that's the, I guess, the core of the report, looking at the breakdown into each individual phase that we have coming through here. Now, I won't cover off each and every different criteria because there are a lot of them, but I will speak to some of them that are a little bit more complex or a little bit different to others. So 1A is our specific work groups, so healthcare workers, frontline workers, etc. But also those patients who are in aged or disability care as part of that. You will see mostly these numbers are quite low, but mostly that's not happening in general practice anyway, so hopefully that's not an issue. Basically, we're picking up our aged care residents through MBS items claimed through your practice. So if you've had an aged care item claimed for a specific patient, or if you've had a visit type that is set up for RACF. So some softwares allow you to specify what kind of visit it was, such as a an email or SMS contact, a visit to a hospital, or if it was indeed in an aged care facility. So that's your phase 1As. Again, numbers should be probably going to be fairly low unless you are specifically doing a lot of work in that space. Going from there, obviously the one that we're really interested in as of yesterday and possibly a little bit of last week is our phase 1Bs. So these are the fairly broad categories around specific conditions that patients have, chronic diseases, certain age brackets, Indigenous patients as well. A few different categories there. I'll show you how to access all those. And then, I won't go into detail around 2A, B, and 3 and 4. You'll be able to get that information out of the mapping and the documentation a little bit later. So just using the report, we can flip through individual tabs. So if you're used to using the hospitalization report, you should hopefully be used to using the system. I will ask if people hold off from accessing their own reports right this very moment. We don't usually have 200 odd people looking at a report at the one time, so it might just slow down my system briefly. So vaccine rollout information, as I mentioned, the patient phase details, and then phase criteria is just a bit of a documentation aspect. That's your navigation bar along the top there. We do have our quick selection for RACGP active. Now, we also have a disclaimer on this. Obviously, it is the vast majority of patients are expected to be receiving this vaccination, not just RACGP active. So please keep in mind there might be a use for RACGP active in terms of identifying who your regular patients are to do recalls, but don't inadvertently exclude other patients just because you're using that criteria. So that's your patients who have had 3 visits in the last 2 years. That it is important to remember that that should be used specifically in certain instances, and it's just a matter of clicking, and that'll actually filter that list down. You can see the numbers drop quite significantly. It's there, you can use it, but just keep in mind that little nuance. Down here is the phase selection. So we can pick up patients who are in the first 3 phases. Phase 4 is basically anyone who doesn't fit into any one of these other categories, which generally speaking is patients who actually don't have a date of birth recorded, therefore don't have an age. It's a bit of a catch-all in that process. So if we want to look at phase 1B, which is what we're at the moment, we can simply click on that button and you'll see there it has broken this down, which takes us on to the next element. So down along the bottom here in a few different areas, you can see information on how many vaccinations a patient has received, or patients who have declined over here. So you can see the shading here. These 2,700 odd patients have received no vaccination so far. We have 491 who have received 1, and then we've got 926 who have received 2 to date. Those are the patients who have, a patient who has declined sits down there as well, but we will not look at the moment. I will point out this is not based on Australian Immunisation Register data. This is data that is held within your practice. Therefore, it is important, especially in this instance, to make sure that you are recording if a patient has had the vaccination elsewhere, you are recording that in your software. which very briefly I will segue across to education because not everyone knows how to do that. So this is the education part for this report. But if I'm just going to demonstrate quickly here for best practice, I've gone under source data immunizations. We can drop that down, and here you can actually see you can record it by changing the billing provider to not given here. That will allow us to identify that it has been given elsewhere. Medical director has vaccine given elsewhere, tick box there. Looking at this phase tracking table here, we do have the breakdown of the individual phases. And of course, we have the counts of the patients going through with quite a number of patients being the balance of the adult population, I believe, for 2B. Yep, make up the vast majority, obviously, of the patients in that record. You can actually select patients who've had one, more, or nil of the vaccination. So if I go back to my 1Bs again, I can click on my no recorded vaccinations. You'll see all these numbers drop off. Now I am looking at specifically the cohort in 1B that has not had a single vaccination dose. If you're not familiar with POLA yet, because we have got quite a number of people in here today, there is a patient list up in the top right-hand corner that you can click on. And then you can do an export to Excel to be able to pull out those patient details. I will say if you are a MedTech site, I will show you a different process in a moment, just because MedTech does have a slightly different patient identifier, which we can't currently work with. There is some basic information around the bottom of the report that basically just tells you around I guess disclaimers, and also a link to some of the mapping. So this is the most recent Department of Health guidelines we have, and also another link to our POLA mapping process here. Jason, I'm not going too fast, am I? I'm aware that we've got a lot of content and a little time, so.
No, absolutely perfect, Shane. Everything's great.
Perfect, excellent. Okay. So that's phase tracking. Again, that's sort of a broad, I guess this is probably a dashboard, really where you're very quickly looking at, the broad scope of where your patients fit into the categories. We can also see under the vaccine rollout information, a bit of a tracking process. So this one is showing this beautiful reverse waterfall, showing you exactly how you're tracking across against your entire patient cohort, but also against your individual phases. So over here, we can see we've got 96 patients in the phase 1A, 31 vaccinated or declined. So there is cut off a little bit there, but you can see the context down here. 4,174 in the phase 1B, again, a number that have been declined. All of that leads up to how many patients that we have, I guess, who haven't had the dual or double 2 vaccinations in your record. So this one's just a bit of a visualization tool. We can click on an individual page, phase, just to be able to drill down, be able to see a little bit more detail, that sort of patient count. Finally going, just make sure there is a little bit of information along the top there that might be of interest, but moving on. This is the last major part of the tool. This is the patient phase details. So this will give you some quick insights into at a patient level to see how things are going. We can do things like, I will go back into my phase 1B because obviously we're there. So you can do some things like data quality, unless this person truly is 268 years old. You can do some data quality, but more importantly, you can actually see things like what criteria the patients have come under. So, well, all of these are going to be over 70 because they're all over 70. I'm going to just flip that around for a moment. Change the order. Oh, there we go. Sorry, a little bit quick. So now we can see, for example, Abby here has a mental health condition, and that's the criteria that that she has fallen under. With that, we can see that she's had a Medicare card recorded. If we want, we can filter so we can actually target just Medicare patients. Obviously, part of this rollout is going to be the funding source around it, as well as whether or not you need to bill someone directly. And then finally, next one, what status they have. So again, the no vaccination, 1 declined or 2 vaccinations recorded. I'm actually going to select this one here because I'm trying to showcase something specifically, which I do have record for. Along here, we'll have the 2 vaccination dates. So we can see, this patient here, Phoenix, has had a vaccination 21st of June 2019. Again, ignore the flu quadri. This is just demonstration data. But we can also see very quickly where a vaccine has been marked as given elsewhere. So again, very important to make sure that you record that in your software if you're aware of the fact the patient actually had it elsewhere, especially where it comes to patients in 1A. We otherwise won't see that data coming through and won't be able to provide you that information to let you know that's what's happening. You can quickly view the diagnoses associated with the patient record. I will point out the little asterisk at the start of the asthma actually indicates that that is a chronic disease. So if I come and pick up poor Gustavo here, we can see, we still only got the single chronic disease. No, we've got the next one. There we go. So Leah here has 4 chronic diseases and another 7 diagnoses in there as well. So that's what that indicator is. If we want, we can drill down. This is specifically for phase 1B. We can drill down on the individual reasonings behind the eligibility. So, for example, patients with a very high BMI, we've got that there. We can do things like we can say, well, we want to just look at our, they're all Medicare carded anyway. We just want to look at our patients who've had no vaccination recorded, and we're going to probably try and pick up those who have the highest number of diagnoses. I can't remember how to get that one to go. So we can have a look at things like our Bianca here, whether or not she's ready to come in. And again, everything comes back to, so we've got our 69 patients here. They are in phase 1B. They've got a high BMI. They've had no vaccinations recorded. We go to our patient list. We do an export to Excel, which this will look slightly different because this is just a fake spreadsheet. But when you get it out, it'll have your patient details there, and off you go. Now, I probably don't have anyone who has MedTech listening at the moment, but just in case I do, you will see a little export button up the top right-hand corner here, and it will actually give you this with the patient IDs, not the name of the patient, just FYI. So please do keep that in mind. That will be in the documentation as well, though, so you will be able to find that out. Lastly, we do have a phase criteria table. This is probably the intermediate level of mapping. We've got more full mapping in the actual mapping tool, but this will give you a little bit of a brief synopsis around how the patients actually fit into that category. So we have those in there for information. Now, this is great. I'm nicely ahead of time, so I'm hoping we can actually get some questions done, enough to keep people satisfied. So I am going in now. If you're not familiar with Polar, when you are in a report, we do have under the help menu here, data mapping for this page, in this case, data mapping for this report, which then will lead you through to our Polar education platform. You may need to log back in again. So it's using the same username and password as you use for Polar itself. So you can use that in there. It's just the username and password, not your email and password, username and password. Once you're in there, you can actually break this down in the same manner as you do in the reports. We've got our navigation tool here where we can see each of those, and we can actually read some more information around what each of the components are. So, our vaccination phases, status breakdown, and status selectors there. And of course, going through, we can have a look at our patient phase details. This is probably where people are going to want to come. This actually outlines very specifically in great detail each of the categories that we have and exactly how we come about picking up those patients. So if I were, for example, to go to my patients with, well, we just looked at that one, the patient's BMI greater than equal to 40 kilograms per square meter. Sorry, the dog's getting louder. we can see here that it's only including patients whose most recent BMI is 40 kilograms per square meter or higher, where the BMI is recorded in the past 24 months. Now, we'll point out all the phase 1B groups are aged 18 and above, because that efficacy hasn't been proven yet in those under 18, and that is they're a later phase in phase 3, I believe. So look, I will probably just open up the floor there. I understand that was probably if you're not familiar with the tool, that might have been a lot to go through, but I really wanted to try and recoup some time to get some questions through. So yeah, I might, if you've got any questions there, Jason.
Yeah, sure.
Fantastic. Otherwise, if anyone wants to raise any, please do through the question and answers functionality.
Fantastic. Yeah, and as Shane mentioned earlier, we'll be collating all these questions and making this available afterwards for review. Yeah, just a couple of questions, but a great turnout. Thank you, everyone, for turning out to today's webinar. It's very topical, and so it's always good to have a large number of people watching what we're up to. The first question was, can you show us how to get a list of patients with connective tissue disease, such as arthritis? I'm probably thinking, Shane, it's probably more a different report rather than a COVID vaccine report.
Please feel free to come to the next Q&A webinar. We'll probably be going through some of the other reports as well. That's not this report, because there's not a specific, that's not COVID specific at the moment for these cohorts.
If you're new to Polar, there's a whole heap of other Polar reports out there, and it's probably the one that you want to see there is Clinic Summary. So by all means, if you log on to the platform, you should see Clinic Summary or talk to the admin person within your practice to get access to it, and that will definitely help you look at patients with particular disease groups for that one.
Even better, I'd probably suggest that you touch base with your PHN representative, because they'd love to take you through the tool as well.
Yeah, exactly. So yeah, definitely a way to do that. The next question is, for recall purposes, using this report, all patients in 1B, they would qualify for government-funded flu vaccines too, wouldn't they? Could we use this for that purpose as well?
Yep. Okay, that's going to be a follow-on to the next question, to the last question. So that already exists in the Clinic Summary report. So please do contact your PHN. They should be able to show you how to get that. We've actually already got that coded out.
Yeah, as of last year, we did a lot of extensive work on flu vaccinations, and for example, the free flu vaccinations which are on offer. So there's actually quite an easy way for you to select that cohort. Once again, using Clinic Summary. So that would be the best report to use for flu vaccinations. It's just that for this example, you're seeing flu as an example, because there's not heaps of data there in the COVID space. So
absolutely,
that's probably why it can be a little bit confusing. Definitely. Okay, Shane, can you please go to the screen showing the tip for entering immunization information in Medical Director?
Yeah, absolutely. I also, again, will show you how to get there, because not everyone's using Medical Director, obviously. So again, when you're in here, go to the help menu. It probably helps if I actually bring this so you can see it full. Go to the help menu, go to data mapping for this page. And at the bottom of this page, I've actually got the source data listed out. So if you want to know where we pick up, Indigenous status or RSCGP active or patient age, etc., you can click on the topic and then drop down your source, your clinical system. There we go. And it will actually tell you where you can find that information. So in Medical Director, it's under the IM tab, as you can see there. And if you're marking it as given elsewhere, you can put it in there. So I think there was a question as well around.
Yeah, similar kind of question for best practice. Do we have to record declined vaccines? And if so, where in best practice?
Yep. So there's not specifically a place that I'm aware of, but we do pick up through the name of the vaccination given. I know we generally encourage not the non-use of free text, but in this specific instance, that's actually how we pick it up. Is if you type in, declined, what's the name of it? AstraZeneca, we'll say, then we'll actually be able to pick that up as a declined vaccination. As you can see in Medical Director, there's a tick box there where you can actually mark it as the vaccination declined, which we do pick up, but yeah, I'm not aware of the same process in best practice at the moment.
And that will come through on the report as that little new square.
Absolutely, yeah. So you can see that little box down there where you can start selecting those patients.
Yeah, so patients have declined.
Or
Fantastic.
exclude them is probably more interesting than identifying them, I
Decline.
guess. Yep.
Okay, that's the questions for at the moment. Any
Yeah.
other questions?
If there are any come through, and I'll probably just again talk to just a couple of things. I just really again want to emphasize the way that you're best going to get use out of it is getting into the habit of recording where vaccinations are given elsewhere, if that is happening for your patients. Make sure that's going through. We are somewhat manually mapping the names because we haven't necessarily seen all of the new vaccinations coming through in our test environments, our virtual environments that we have for the software. So that's fine. As long as it contains something like AstraZeneca, COVID, etc., we're generally picking those ones up. So that's great. But obviously, if you do have a proper drop down there with the correct name of the immunization, it always makes it easier for you and for us down the track as well. Any other questions out there?
No, we've answered everything. So no other questions coming through. Hopefully that means the report is completely self-explanatory and it's doing everything it needs to do.
I hope so. And look, as I said, this is recorded. We are going to put together an FAQ. There is documentation there around how to use the report. Feel free to jump on and have a play. I'm guessing every man and his dog is probably going to want to jump on now and have a play with it. So it might just be a little bit slower than usual, but as everyone sort of gets their fill of playing with it, it should start picking up again. Look, please do get in touch via your PHN if you have any questions. We're here to hopefully assist as much as we can.
Probably from an advice perspective, Shane, what do you reckon? Probably hover text and mapping will become your best friend in trying to understand exactly what is true.
I should point out, yes, there are these little eye boxes. So a lot of our reports now, we add additional context into the hover text because obviously screen real estate is at a premium. So that is in there. Just if you see one and you're kind of like, oh, I don't know what that is, you have a look there. I will say some of these are just going to be regrouped so that you might see some changes. It's just to sort of neaten it up a little bit because the number of the criteria is just amazing. So we're just trying to tidy that up a little bit to group certain things in there. So you might see some changes, but it won't change the usability of the tool.
Yeah, but always watch out that hover text is an amazing amount of information sometimes buried there. Yeah,
absolutely. Yep, that's it. Great. Actually, I will say one last thing, just because it did come up. Yes, there is a COVID-19 clinic report. So if you have that, that's the report we released last year. So this one is about testing, pathology, diagnosis. So it was about tracking what sort of activities are occurring in your practice around COVID. This is look for the syringe that kind of resembles a carrot, which is the COVID-19 vaccine planning. That's the one that you'll want to be using to be able to have a look at your data. And I did see a question there about how do we download Polar and link it to our software. If you're on this webinar, you probably already have it installed. Touch base with your PHN. They'll tell you how to use it. If it's already installed, you access it via an internet browser. We recommend Chrome, but again, I'm not covering that off today. This is just about a specific report. But that said, if there's no further questions,
I think that's it, Shane. That was the last one.
Okay.
We've got a minute.
I just say, look, do touch base. Have a chat to PHN if you have any issues or queries. Or if there's a usability enhancement you think of that you'd love to see, do let your PHN know. They'll raise it with us. I understand this is probably doing everyone's head in because obviously, I mean, we've just seen the sheer number of immunizations coming through in the past a little bit over 24 hours now. So clearly it's manic out there in the world. But look, hopefully this will help a little bit, allow you to manage your patient lists and let us know if there's anything else we can do.
Fantastic. That's it.
Perfect. Great. Thank you, everybody, for coming along. I will upload this pretty shortly and have it loaded into our education portal. So yeah, if you have a moment, jump into a report, go into that help menu, which actually the portal is help, and you can go to the data mapping, and then you can jump across to your polar practice support, and it will be in here somewhere, or have it listed on the front page.
And once again, please feel free to send any feedback or advice to the PHN so they can feed it back to us. And this way, as a group, we always make the reports better.
Yeah, that's it. Perfect. Won't take up any of time. Thank you very much for coming along, and hopefully we will see you again in the future Q&A webinar.
Fantastic. See you, everybody.
Thank you.